Okay, hi everybody, and welcome back to our first ever digital program for NMU Day of Giving. We are really excited to be here. We hope that you're out there wearing your green and gold pride wherever you are and ready to come together to support NMU. In case you weren't here for our program highlights earlier today, my name is Kylie Bunting. I am a 2011 NMU grad and also currently the Digital Engagement Architect at Alumni Relations.
I knew I was going to get that mute button eventually here. Hi, everyone. My name is Andy Hill. I'm a 2003 graduate, and I'm also, here we go. Now I'm here. I am talking to myself, and I didn't have my mic all set up here. Sorry about that. Hi, Andy Hill here. I'm a 2003 graduate of Northern Michigan University. Also the Associate Director of Annual Giving with the NMU Foundation. Wanted to let you all know that we'll be your hosts for today and for the rest of our program this evening. And while I have you here, I'll just like to give a special thank you to our NMU Day of Giving partners. These are companies and businesses who've been leaders in giving us an expanded ability to help grow our resources and spread our message to encourage and inspire others to participate in our Day of Giving initiatives. These are Stevenson National Bank and Trust, TV6, Morgan Stanley, Jabara and Rogers Group, and the Upper Peninsula Health Plan.
Great. Well, we're really excited to have you here for our next check-in with Jacob Daar from the Bear Center. First, I want to just go over a couple of logistics. We are unable to see and hear you in this webinar format, but we still want to hear from you. So please use the Q&A function at the bottom of your screen for any questions for Jacob as we go along through this portion of the program. We'll be monitoring it closely. And also, you can use the chat function to talk along with other people who are watching. You can share where you're from, your grad year, or tell a great story about you giving back to NMU and what it's meant to you. Just a quick note on that chat function as well. The default is to all panelists, but you need to change the option to all panelists and attendees, so everybody, including the people watching, can see what you have to say.
And as we mentioned, we will be here throughout the day with exclusive interviews from NMU faculty, staff, and students, and providing you with updates on our giving goals. There is one Zoom link for the entire day, so feel free to come and go as you please and join us for any or all of the rest of the program.
And then also don't forget to follow the NMU Alumni Association on social media. We'll be providing real-time updates with our NMU Giving Day milestones, some student and donor impact stories, videos, and more. And then also, if you're participating with us today, make sure you use the hashtags on social media, NMU Day of Giving, NMU Grow Wild, and Cats Care. Also, if you'd like to post a photo of yourself wearing your green and gold and tell us how you've supported NMU, you might be featured on our social media channels as well.
And I thought now would be a good time to give a few updates on where we're at so far in our day and how things are going for Day of Giving. The one thing that we did want to bring to everyone's attention who's listening and watching with us right now is that we have a really cool giving challenge going on to encourage more gifts and more money that can be dedicated to the Bear Center. So right now we have an unlock gift of $5,000, and this is thanks again to our partners with Morgan Stanley, Jabara and Rogers, and the Stevenson National Bank and Trust. And so what we have going on is that if we get 25 donors to give today to the Bear Center, we're going to get an additional $5,000 to go support the center thanks to these partners. So right now we're at over 60% way there. So we have 15 donors of the 25 that we need. So if I do my math right, We only need 10 more donors in order for us to get that $5,000 gift. So if you haven't made your gift yet and you're thinking about where you want to designate your dollars for Day of Giving, please think of the Bear Center. Again, this is a great way for us to get even more resources that they can use for the coming years. The other exciting announcement that I wanted to make in terms of where we're at in our progress, still counting and still seeing things come in, but we're already just over $400,000 in the door for Day of Giving, which is really exciting to see at this point, and that number is climbing. Won't be able to do any official announcements today as we tally and record things, but a really cool milestone at this point in the day to see those types of participation in dollars coming in the door at this point.
Awesome, that's really exciting. It's been a great day so far. So now we're really excited to welcome Director of the Behavioral Education Assessment and Research, or the Bear Center, Jacob Daar. He's going to share with us some how some of the recent Michigan Health Endowment Fund has allowed the center to expand its services, and also some other really great stories that we're going to hear on the things that are going on right here on NMU's campus. And the support from donors like you can help the center continue to make a major difference in these families' lives. And you'll see that as we go through. We have a little video for you to watch as well. But first, I'd like to welcome Jacob. Thank you for joining us.
Hi, Kylie, and hi, Andrew. Thank you so much for having me here. I'm really excited to talk to everyone.
Great. So before we jump in, I know that we have created a really great video that highlights all of the great things that the Bear Center is doing. So we thought that would be a good way to kick this off so we can have a little background information, and then we'll let you take it from there. So give me 1 second as I share the video here. And just to note that if you have trouble seeing or hearing the video, we will shoot the link to the video in the chat just after this, so you will be able to watch it later on as well. But hopefully you'll be able to see and hear it.
The Behavior Education Assessment Research Center, or the BEAR Center, is an arm of the Department of Psychological Sciences here at Northern Michigan. And essentially what we are is we are a multifaceted service providing agency that specifically focuses on providing behavior analysis services. And we function both as a support to the community in terms of providing direct services, but we also are essentially a practicum training facility. When the Bear Center was created, there was only about 13 behavior analysts in the entire Upper Peninsula region, and that actually included a lot of Northern Michigan as well, which it was a huge deficit in service, right? So the Bear Center, when we founded the Bear Center into now, we've almost doubled that number. So last time I looked, there's about 40 behavior analysts in the UP, but half of them are part of our program, right? So the Bear Center does a number of things for the university and for the community at large. First and foremost, as a university, it is a training center for students at both the undergraduate and graduate level who are seeking to gain credentials as assistant behavior analysts or board certified behavior analysts, which are both licensed in the state of Michigan. Now that the Bear Center is here, we train somewhere in the range of 30 to 40 students a year in practicum sites. So that we've managed, the Bear Center has helped to bring that training opportunity, and we do that training across children with language deficits, children receiving services, behavioral services in the through the Medicaid and community mental health facilities. We work with the schools. We're providing training for students to get experience in the schools. We work with the aging population, students who want to work with behavioral management and behavior difficulties associated with dementia and Alzheimer's, Parkinson's, and so on. Now, on top of that, we are a full behavior analytics service provider, and in fact, we've recently received a grant from the Michigan Health Endowment Fund to expand our services, which have generally been focused on very young children, so the early intervention age, as well as and doing language, and now we're expanding to be able to work with what they call school-age children, which would bring it up to 22.
If we didn't drive out to some of the school locations, students wouldn't actually be receiving any behavioral services just because of the way that their home lives are set up, or their parents' schedules. School is their source of treatment. And a lot of times too, if their behaviors are too excessive, they potentially could be kicked out of school, especially once you get into those older ages where certain things are expected of a student. Sometimes teachers don't know the best way to handle it, and not only that, but they have 30 other kids in their classroom that also need their assistance. So when you have a kid that's, say 14 years old and won't sit down and do his homework, it's difficult for them. So with us going in there, we kind of give them a little bit of help, and not only that, but we take care of the student and give a little bit more one-on-one services for them. I love having the vehicles. It has been a tremendous help, and especially because, we did get really nice vehicles. I feel a lot safer driving everywhere, especially because we live up here in the UP. You do not know what the weather is going to be like, and just having safe transportation and it's reliable, I am very grateful for this. I think it was a great addition to our program.
Having the opportunity to come here and start applying all of these things that we've talked about for the past 4 years, it really helps make those connections and help build, a better skill set for this line of work. Those things where I've come to find out talking about it is one thing, and then actually being here and being able to practice that is a totally different thing. And I don't think I would have gotten nearly as much out of the program if I hadn't had the opportunity to come here and work and get this experience. This gives people the opportunity for services that they may otherwise not have. And looking down the line as well, having training technicians to come through this program, and most of them looking to sit, to be certified clinicians. The more clinicians who want to stay up here in the future after graduation, we're just expanding the available resources, for the community up here, really. It's satisfying being able to see a client make progress. That's super cool, watching them develop new skill sets and, watching them demonstrate it while they're here, and hearing from the parents how, well, they started doing this at home, they did this at home. And it's like, hey, that's awesome. Being able to help some of the clients, and that if it wasn't for the center here, they may not have the same opportunities. And I know I mentioned that before, but I think that's really important. And being able to be a part of that and say that you help these people out.
Wow, that's amazing. It's really cool to see that we have something like this on campus, and I know that video covered a lot, Jacob, but we'd love to hear some stories from you. Tell us a little bit about the experiences and some things that have happened at the Bear Center.
Sure. Well, I think it's helpful maybe first to kind of understand what the Bear Center is a little bit. So the Bear Center has a number of programs that we operate, and the all of which are centered around providing behavior analytic assessment and support for families, as well as providing a training ground for students who are seeking credentials in behavior analysis. It takes somewhere in the range of 1,000 to 2,500 hours of experience prior to being able to gain your license. And this is in an area of great shortage across the state, in the country as well, but more in particularly for our region. And so what that means is that we have a number of programs that provide that service. The one that most people hear about is something we call the Early Intensive Language Learning Clinic, which is our free to the community clinic here on campus. And so that's a clinic for children ages 2 to 6 who are demonstrating significant language deficits. And language deficits are really one of the most impactful deficits that you can be displaying at that young of an age. And the reason for that is that's most problem behaviors, difficult to manage behaviors, behaviors that turn into self-injurious behavior, aggression, tantrums, non-compliance, and non-cooperation, and the kinds of things that are highly disruptive and difficult as the child gets older are usually a language issue. The child not being able to indicate what they need or want, not being able to understand why something is being denied to them, and so on and so forth, not being able to indicate that they're in pain or discomfort. So that's part of the reason why we have that clinic. And the other thing is that a lot of your social development and a lot of your intellectual development is very tied to language skills. And so the children that we see there at the clinic are demonstrating pretty significant language deficits. This is usually associated with developmental disabilities such as autism, Down syndrome, other kinds of intellectual and developmental disabilities. And so that clinic is the one that we usually, when you hear about the clinic, that's what we're talking about. That program has always been free to the community. It's diagnosis free. And so families from all across the UP have brought their children to us. We've had families, most of the families are obviously from the Marquette region, but we have families that used to drive to us multiple times a week from Iron Mountain and Kingsford area to come for a 2 or 3 hour session that they wouldn't be able to get in that region. And so that service, that's what our clinic does. Now, outside of that, we have a couple of other programs. We work in the school systems to provide functional behavior assessment and behavior intervention support. This would be essentially helping children who are having a lot of difficulty in the classrooms, staying in their classrooms. These are children that are typically, sent up to the office. They're missing large amounts of their educational experience, being sent home, and at a level in which the schools may not be equipped to deal with. And so we've been helping with that in a number of schools. In particular, we had a grant working from the West End Health Foundation to work with the NICE community schools, so the Ishpeming, Negaunee, Michigami Republic, and so on. As well as that, we have a lot of collaborations with the community mental health facilities in the UP, particularly Pathways. So we have students that work with them in behavioral health. And so, and then we have a couple of new programs as well, such as working with the aging population. So as individuals get older and issues relating to dementia and Alzheimer's and so on, start to produce behavioral difficulties that really can lead to some pretty drastic decreases in quality of life. And so we work with staff and facilities that are helping to provide services to those individuals to help deal with some of those difficult to manage behavioral issues. And again, everything that we do is focused on kind of a positive approach. Everything we're trying to do is help individuals make contact with the things that they find reinforcing in a way that's going to promote adaptive behavior, whether that's teaching language or helping individuals in a resident facility to find better ways to interact with those around them. So that's what we do. And so I just think it helps to provide that context in order to help understand what some of the basis of some of these stories are. So when I'm talking about a family who would drive 2 hours one way to get a service, we're talking about a family who has a child who has such a significant language deficit that they would feel the need to make that drive. And it's in some ways it's kind of hard to describe what the deficit of services are in the UP. We know across the entire UP, we're always struggling with being a rural area. You know, we like, even in Marquette, you know, we like to talk about Marquette kind of being this big hub of the UP, but we're really quite small when it comes to service providers. So children, for example, who are coming to the clinic, in order for them to access behavioral health through insurance and through Medicaid, often are on 6-month waiting lists just to be seen to get the assessment. You can't do anything without the assessment. And then you have to find a behavior analyst. And then you have to be able to afford, you know, the insurance or the healthcare. Schools that would like to hire a behavior analyst, there are so few in the UP that they don't have that, even have that option. You know, I've looked at the numbers quite often, and so we have about, thanks to the NMU program here, we have an undergraduate in behavior analysis and a graduate program in behavior analysis, both which lead to licensure and jobs immediately upon graduation. We're starting to approach the point where we have kind of per capita the same number of behavior analysts downstate, but realize we have twice the distance and twice the snow to cover. And one of the things that we're really lacking is being able to do more comprehensive programming. And this means not just in the clinic, not just in the school, but this means getting to the homes. This means getting to the families and getting to the community and helping the individuals that we work with to not just make, you know, gains in their language or educational skills, but make gains in their adaptive living and their social skills. This means going to their homes. This means going to the community. And this is where the Michigan Health Endowment Fund grant that we just got, we got a $500,000 grant to help expand the services we've been doing to not just be the clinic for little children, but to expand it to work with children up to the age of 22, which is essentially when they're leaving school, and to provide more comprehensive services. So this means not just having them come into the clinic, but being able to go into the homes, be able to support the families and the caretakers, to train those individuals how to better facilitate, if you will, behavioral growth and behavioral adaptation for the individuals that are experiencing these difficulties. Again, kind of saying we work with children who have kind of difficult to manage behavior that you might think of, you know, throwing tantrums in public, refusing to go out. But then on the other end, we work with children with fairly significant and fairly intense problem behaviors. This could be self-injury. This could be not eating. We had a client at one point, the only thing this child would eat was essentially Burger King chicken fries, which on the face value, we know that's not healthy. But when you think about what that means, is the parent has to always make it to a Burger King to feed this child, or this child might hurt themselves. You know, and so what happens when the one Burger King we have in town is closed? What happens when they run out of chicken fries? You know, and so like it, you know, it's kind of funny to think chicken fries, but the reality is this is a very common issue for children with significant developmental disabilities, is that they gain this kind of very overly selective, narrow types of food. And we're not talking about someone who's sensitive or picky. We're talking about someone who has significant problem behaviors associated with it. In order to treat that, you need a center like the Bear Center. It's not something that even most behavior analysts or most behavioral health professionals are trained to do. So that's one of the nice things about having a university center, is it brings a lot of talent. And I don't just mean our faculty, I'm talking about our students who are focused on training, who are there 20 hours a week, who are constantly researching and trying to find new ways to help improve the services that we provide. And so the nice thing about the center is it brings a lot of that talent and keeps it kind of in one place. And then on top of that, our relationship with the community centers, going to the community mental health facilities, working with the schools, means there's a better chance that we're going to be able to keep that talent here. Most of our students are from the UP, but they, you know, as most of us know, it's very easy to get jobs outside of the UP and that pay better. And so we're really trying to work on building an infrastructure here, such as through the, we have a grant through the Superior Health Foundation that started the Upper Peninsula Behavior Analysis Association for Behavior Analysis. So we're trying to create better networks and better systems to support that infrastructure. I know I've gotten a little bit away from like talking about individual stories, but you know, it's kind of difficult because we can't really talk about clients directly. But you know, there's quite a bit of variety in the kind of kids we see. We've had children who've had traumatic brain injuries, you know, from car accidents and other, you know, sort of accidents kind of come in, as well as developmental disabilities. And then as you get into the kind of, and those are just the families that come to the center. One of the things that we're looking at here is as we gain more funding, is we actually want to be able to expand the number of clients that we can take, and thus the number of experiences that we get. There's actually kind of a direct connection between, you know, obviously between clients that come to the center and the amount of experiences we can give to students. For every 10-hour-a-week client that we have at the center, we're able to, that's half of a, essentially half of a student's practicum load. So the more clients we're able to bring in, the more we help the community, the more behavior analysts we're training as well.
That's amazing.
I think there was a question. It's
Yep.
kind of, I'm not able to read and talk at the same time.
I can read it for you. So yeah,
Sure.
we had an audience question come in. How is the Bear Center helping to improve capacity for professionals who provide behavioral therapy services in the UP? And what are some of the center's goals to retain student professionals in the region? I know you kind of touched on it a little. Uh-oh, do we lose you, Jacob?
Jacob may have froze. I did notice his cat was sitting on his lap. So hopefully there wasn't an animal
technological malfunction.
But while Jacob's working back, oh, there he is.
There he is. He's
Sorry.
back.
Okay, so I think Andrew, were you saying something?
Oh no, go ahead. We were just filling time until you join.
Okay. So I guess to address the question, you know, I think there's a couple of things that we're doing. And first, it helps to understand where behavior analysts work and what they do. Behavior analysts are a licensed profession in Michigan. And so they can work the same way like a mental health therapist would work, kind of having their own shingle, if you will, their own practice. But many behavior analysts work with the Medicaid system and work with large clinics and that sort of thing. Currently, there's very few private companies that have behavior analysts working for them. And part of that is just the licensure for behavior analysts only went into action about a year ago. Even though there's been an insurance mandate to allow for behavior analysts for quite some time now. And so this is something that's growing. One of the things, but part of the thing that we're really pushing at the Bear Center is to not just train behavior analysts who are highly focused on early intervention. Many behavior analysts, the training programs that they go through are focused on very young children with kind of a narrow set of problem behaviors and a narrow set of needs. And so we're trying to program more broadly. Part of that means building up an practicum experience that not just serves young children with language deficits and with kind of typical behavior deficits, but this means bringing in more significant, more severe problem behavior for not just for us to be able to help provide services, but to train future professionals in how to address those issues. This means training our students to work with older individuals, children who are transitioning into adulthood, as well as the aging population and adult services. On top of that, we have programs that are, we have a program in organizational behavior management that's led by Dr. Ashley Shader, who works with agencies to improve staff training, which is a big part of what behavior analysts do. We kind of joke that we don't really, work with the child, we work with the caretakers, we work with the staff, right? We work with the schools. They're the ones who are really the change agent in that child and individual's life. And so it's a lot of what we do is consultation for them. So we have organizational behavior management programs that do that, as well as work with other kinds of companies and organizations that have human factors components, right? And so what we're doing there is helping the agency to improve staff training. We're helping them to improve safety skills, or kind of just anytime you want to increase, decrease, modify, or maintain behavior, we can help. And so by broadly training our students, it means that there's a lot of expertise that they're getting from the center that they wouldn't get if we just put them into practicum sites in general, which I'd mentioned barely exist in the UP, right? So in order to become a behavior analyst, you need to be supervised by a behavior analyst. There's not that many. And so the university has an intensive practicum. It's called an intensive university practicum, which there's not many programs actually maintain these. And this actually accelerates the training time and thus requires less training time overall. So our students do 20 hours a week with double the amount of supervision that they would get just working in the field. This allows us to kind of make sure that they get trained more quickly. Now, one of the questions, I think part of that question was, what are we doing to help retain student professionals in the region? This is a big part of that for us has been placing students once trained into sites and in working with organizations that would be hiring them eventually. So that's part of our focus on working with the community mental health facilities, with working and supporting local agencies. You know, it's one of the things that we try to make sure that we're very conscientious of is, while we want the Bear Center to grow and to have more clients, I want to make sure that our students are able to make a living in the UP. So part of our strategic plan is to really focus on trying to fill gaps in service rather than take over service. And so my goal with the Bear Center is we want to enhance the capacities of the schools. We want to enhance the capacities of the community mental health facilities. We want to enhance resident facilities training and staff, so that not only are they able to better care for the individuals that they have, but also better equipped and understanding of how and when to hire a behavior analyst, which is, I think, one of the a big important thing. And so we've seen a growth in the number of practitioners who've stayed in the UP, I think, as part of this. On top of that, we actually work with our students quite a bit to help train them how to run a clinic. So the Bear Center itself, the clinic that we operate, is almost entirely student run. So we do have a clinical supervisor, Victoria Matson, and Colin Hahn, who are our full-time clinical supervisors and alumni of our program, who are essentially the clinical directors, if you will. So they oversee the cases, but our students do the vast majority of the work in terms of direct service with the children, in terms of assessment under the guidance of our clinical supervisors. That means that our students get a lot of experience in working with the parents and working with the kids in terms of scheduling, in terms of understanding how billing and such things works. And this better equips them to enter directly into the field and to start their own agencies, which is something that the UP is going to need. We need them to go back to their hometowns, and we need them to, provide services there.
Yeah, that's great. We have one other comment followed by a question from Stephen Young. Thank you for all of the outstanding work you and everybody does at the Bear Center. We are indeed lucky to have this facility at NMU. And then he'd like to know, how has COVID impacted your ability to provide services?
Well, that's a great question. So the main difficulty with COVID and kind of COVID related safety is that a lot of the children we work with, they have difficulty wearing shirts with tags, let alone a mask. And so that's been a big part of kind of taking into consideration the kinds of kids we work with. So we actually immediately, we always had a telehealth component to what we do. We always give that as an option to parents, though it's difficult for many of the parents to take advantage of it, because it is very difficult to work with some of the kids that we work with. So we really kind of supercharged our telehealth program, and so even though we haven't been able to see the kiddos in the center directly, we immediately moved to telehealth services. We providing parent training and kind of constant contact with the parents that for those that were interested in that service. I am happy to report that we are going to be returning to face-to-face services actually on the 8th. And so that has been something we've been working towards for the last couple months with obviously with greatly enhanced kind of COVID preparedness plan, working with our medical director here at the university, as well as our safety and risk management teams. And so what it means in kind of practicality is we can only see about half the kids in the clinic that we were seeing at a given time. So our clinic space, we're able to see about 7 or 8 children at a time prior to COVID, and now we can only see about 2 2 to 3, depending on scheduling. And so it's meant that we've had to do a lot of creative scheduling. We have to limit the number of technicians and therapists in the space. So what it means is normally we would have multiple technicians working with a kid, which is, it allows us to do a lot of kind of more sophisticated programming. But this is going to be just as effective, essentially. But we're using tele supervision, so that way our supervisors don't have to be directly in the room with the kids, and so on. So we're really pushing to make sure that kids get service, and it particularly becomes important because a lot of our kids can't attend school. There's no way for them to do that safely. Oftentimes, developmental disabilities carry a lot of other risk factors for infectious disease, not to mention the fact that the children have very low safety skills to begin with, often. And so a lot of the children that we normally see in the clinic haven't been able to go to school or benefit very little from education practices. So we're looking forward to getting a lot of those children back into the clinic, even if only on the limited basis. So I hope that answers the question to a certain degree. But we've really pushed the telehealth initiative. The grant that we got from the Michigan Health Endowment Fund, part of that is to help to do kind of widespread behavior technician training across the UP, which would be training the people who work directly with children and individuals in resident facilities and schools. And so one of the things we're going to be doing is trying to just up the overall professional skill set and professional development of professionals in the UP. And so that should also help in kind of the COVID days.
Right.
So Jacob, you've talked in length about the center and what it really means to community members who are in need of these services. And really from an observer standpoint, you and your staff and the students who are here are really heroes for many families who are seeking in need of your services. So want to thank you for not only providing that service, but also training future behavior analysis, which is definitely a need in our area. So with today being really all about giving, you've talked about how the grant has really been allowed you to expand and grow rapidly. But talk about how some other dollar ranges can be just as impactful too. You saw in the video that there were the 2 vehicles that were a joint effort that will allow your students to be able to get out there more. So talk about the vehicles, and then maybe go into, like, say you got $10,000, $20,000 today. How would you be able to use that money now to help the center?
Sure. So the vehicles, I think it's maybe I could take a moment to kind of explain what they are. So the Bear Center was gifted 2 SUVs from the Ford Foundation and the Alumni Association and so on. What that was is we provide services to families kind of not just in the Marquette area, but we will often travel out to provide services across the UP. And at one point we were driving, I had 5 or 6 students driving to Menominee, Dickinson, Iron Mountain on a daily basis to provide services. On average, for our first 2 years of the Bear Center, we were putting out about 75,000 miles across with all the students and supervisors to go out and provide the services. This meant that a lot of our students were driving their own cars, that we were driving our own personal vehicles in order to provide the services. And as we talked about, there's a lot of distance and a lot of snow. It's, you really do need a very safe car, to drive, keeping in mind that we provide services to children after school. So in that, 5, 6, 7, 8 o'clock time range often. And so we're driving in the dark and blizzards, in order to provide services. And that's really where the value of those vehicles came in, is that many of the students that we have do not have the personal resources to have a car that is safe to drive at night in the UP. And it's something it's easy to forget about, but it does take a lot. And when you're putting on that many miles, even in our own region, just driving to the schools in Ishpeming and Negaunee can be quite difficult. here. And so students who are particularly undergrads were not able to access some of the experiences that we were providing. And so that gift of those two vehicles really did provide a lot of access for our students to be able to attend practicum sites that they wouldn't be able to, as well as in turn, the individuals that we work with receiving services at a level that they wouldn't have been able to receive. So that's kind of what the vehicles are. And so to kind of address the second part of what you were asking, Andy, the about kind of lower levels of gifts and funding. I mean, there's a direct connection for us in terms of funding with services. And so the way that I often will think about it is for every $25 that the Bear Center is gifted, that's a session that a child might receive. So like a 2-hour session. Every hour that a student or that a child receives services is also is 1 hour closer to certification that our students have. And it also means that we're able to fund our students, which is a big part of what the Bear Center also attempts to do. So one of the things that I'm very proud of is up until COVID, we were actually able to fund all of our master students. This means that we were able to not only attract students from a wider range, not just in the UP region, but this meant attracting students who were going to be leaving the UP in order to go to schools where they could get jobs doing behavior and analytics services in the community, which is kind of the typical way people are trained, right? They go to school while working, especially for our master students. And so that's kind of the way I think of it. Is so every $25 is a session that not only a couple hours of sessions for the child or hours for the child, but also funding that is more or less directly funneled back to our students. The kind of work that we do is not in terms of material technology complicated. I don't need big machines, but what our major our major effort comes from work, the hours that our students put into the center. And so that's I think the most direct kind of thing that you would see. And so if it gives kind of context, $5,000 effectively is 1 semester of service for a child. But that also means 1 master student who doesn't have to go and work, at fast food at odd hours of the night in order to pay for their grad school. So that's kind of where I think that's the easiest place to see how the money works in the Bear Center, if that makes sense.
No, that makes perfect sense, and thank you for explaining it that way. Oftentimes, when we do talk to donors or potential donors, they feel like, well, I can give, but I can only give. It is like $25, $50, and they don't feel that there's value in that because they always hear about the $1 million gifts and how those things really push the needle. But what's beautiful about Day of Giving and really the conversation that we're having right now is that we're showing how anyone can be a part of the change and in the future direction here at Northern. And really, the amazing work that's being done in the Bear Center is not only, as you explained, benefiting those families in our community, but they're really just giving an amazing learning opportunity for our students. And that seems to be a unique theme across many other areas of our campus, is that our students can come here as undergrads and get the hands-on experience that is just really career defining at such an early stage. Can you touch on that just a little bit more as we close out here as to how our students are preparing for that next level because of what they're able to do in the Bear Center?
So yeah, I think maybe the easiest way to understand is that the Bear Center has a kind of tiered training model that allows students to actually begin training about halfway through their undergrad. We help them gain the experience that and training that they need to become what we call a registered behavior technician. And this is a national credential that they can use to get jobs actually quite immediately. having the Bear Center on campus means that we're able to put students in contact with actual practical real world training, hands-on training with staff, as well as to do the kinds of things that they might not get access to until much later in their career, such as assessment and consulting, that if they just went out working in the field, they might not touch on that until late in a kind of master's level, right? So they actually get access to practical training and credentials within the second year of their undergraduate. By the time that they finish their graduate or their bachelor's degree in our program, they've already completed 500 hours of practicum experience in the clinic, doing not just the direct hands-on work with the clients, which is an important part of what we do, but also the consulting work. That's a very difficult experience to get out in the field, because for anyone who's worked in insurance and behavioral health, the billable hours kind of dictates what you do. There is no billable hour for someone without a master's level credential to do consulting. So if you went out without the Bear Center, what would typically happen is students seeking that credential would have to pay a master's level clinician to essentially apprentice them, right? To have them accompany them. And that's a large amount of time that the individual would not get paid. It's essentially volunteer work. So by having the Bear Center at NMU, it means that our students are able to access this experience starting in the second year of their undergrad. They get their assistant behavior analyst credential by the time at the conclusion of their bachelor's degree, and then we have a master's program for them to go directly into. That master's program is then focused on kind of the higher level training that they would need in order to be a full-fledged behavior analyst, as well as trying to bring in other experiences that they wouldn't have outside of it. So even if you did get your assistant behavior analyst credential and go to work outside in the field, you're not going to get to do a lot of the things that the Bear Center allows students to do. So that's one of the reasons why it's so important for us to have this university experience. Having the clinic also allows us to go for things like those bigger grants, to bring money in from outside the UP, to seek state and federal level research opportunities that ultimately are going to be providing services to people in the UP. I think outside of that, just as a little hint to the future of what's going on at the Bear Center, we are also have begun to provide practicum experiences for our students to gain the limited license psychology credential, which is essentially what a master's level psychologist does. So this is essentially counselors and psychological assessment that the UP also needs. It's a huge area area and so in the coming year, our students are actually starting to gain that experience. So this can help us to address things like substance abuse, anxiety, depression, and other trauma and other kinds of these what you might think of as more typical psychological issues. And so there's a lot going on that we're working on, as well as expanding our potential services for traumatic brain injury, as well as our school-based services. So there's a lot that our students can get access to in training, and you need that training while in school in order to be able to go out and do that. And so in order for us to train those kind of clinicians that we want to be in the UP, we need to train them here.
Great, thank you for sharing that.
And then one quick audience question. How many patients does the Bear Center work with at any given time? I know you mentioned COVID has changed that a bit, but under normal circumstances.
So it's a complicated question, because some of the work we do, I said, is kind of consulting with agencies, right? And so when we consult, for example, with resident facilities, we might not be working directly with a client, but because of the work we're doing, we're affecting the lives of 10 or 20 clients in that facility, right? The Bear Center, the clinic, the EILL clinic that I mentioned before, we have anywhere between 10 and 20 clients throughout the year. But remember, these are individuals we're seeing 2 or more hours a day. Our work in the schools, I think we were working with about 20 to 30 children or students in the schools. But keep in mind that a child who's disruptive in the classroom, by helping that child to better adapt and benefit from their class, means that the teacher who's working with those other 20 kids has more time to work with them. And so I would actually, indirectly, we have this very, very broad impact of people that we work with. The direct answer to your question is about, with all of our programs combined, we probably directly work with about 50 clients a year across our schools, across the CMHs, the community mental health facilities, across the clinic. But we've been growing kind of exponentially every year. Our first year we had 2 clients in an office in the psychology department, and we're really, the Bear Center is really only 3 years old. And now we're looking at providing comprehensive services across the UP. So, we've been growing a lot. We've had a lot of support, both from the university, from our alumni, from various agencies. And that's, not to over highlight it here. That's what has allowed us to provide all of these training experiences for our students and to improve the lives of all the clients that we work with.
Amazing. That's great. Well, thank you very much. I know we covered a lot, but it was all amazing information. I think it's terrific to be able to share with our alumni and friends what's going on campus and all the amazing things that the Bear Center is doing and providing for clients and students as well. Andy, any last minute things to add?
No, I just want to thank Jacob for spending the time with us today. To give us a real great in-depth view into the center, the work that's being done there, and how it's helping both our community and NMU students. And I think he gave a really great example of how giving can make a significant difference in the services that are being offered and the learning opportunities. Both large and small gifts can really make an immediate impact, from vehicles to give our students easier access to extend our services into our community. And then also, just sort of the ability to have more training opportunities with increased clients attending the center as well. So thanks again, Jacob, for discussing and talking all this through with us. I know the viewers have appreciated the detail and the explanations that you provide. Really what the Bear Center does, because as we have joked in the past, there's a lot of great work that's being done, and sometimes it's not as easy to explain in a 5-second elevator pitch.
Well, I'd just add, if anyone is interested in learning more about the Bear Center, they can visit our website on the nmu.edu website, as well as contact us. One of the things I just kind of like to make sure is that if there's a family who is at all interested in the kind of work that we do, that they contact us, and not to be worried about diagnosis or whether or not what the funding is. I encourage them all to just kind of contact us to start with, and we can help connect them to the services. So if anyone's interested in learning more about the Bear Center, I'd invite them to visit our website, or they're welcome to contact me, and I'm more than happy to chat with them about what we do.
Great, thank you. And just a reminder as well too, we are 9 donors away from unlocking the $5,000 for the Bear Center. So if you're tuning in now and want to help out, as Jacob explained, $25 actually does make a difference, and can also help us reach this goal to give $5,000 as well. So if you haven't already, go and do that. And again, we want to thank everybody so much for joining us this afternoon, and special thank you to Jacob. And then now we just want to encourage you to grow wild with us. So visit nmu.edu/day-of-giving and give to the departments, programs, or initiatives that mean the most to you. And know that your dollars will go straight to those ideas that you are most passionate about. So thank you very much for joining us. And we are excited to see you again at 5 p.m. Oh, that's my wrong screen, but 5 p.m. There we go. 5 p.m. we will see you for happy hour, as we are closing out our Day of Giving program with Dr. Joe Lubig he's the Associate Dean of the Education, Leadership, and Public Service, and also Dr. Carol Johnson, who's the Dean of the College of Business. So we're looking forward to that, and encourage you to pour yourself a drink and join us, and it's going to be a fun time. Thanks, everybody.
Yeah, thank you.
Thanks.